How to help after ulcer bleeding? Imagine a situation where a stomach ulcer starts bleeding, which can be serious and needs quick attention. Proton pump inhibitors, or NA, play a key role in helping the healing process. They work mainly by lowering the amount of acid the stomach produces. When there is less acid, the environment in the stomach becomes less harsh, which is crucial for healing. This less acidic environment helps blood clots that form over the ulcer to stay put, reducing the chance of the bleeding starting again. Now do this by blocking a specific enzyme called the H+K+8 enzyme, which is found in the stomach's parietal cells. This enzyme is responsible for secreting stomach acid. When NA inhibit this enzyme, they significantly decrease acid production, which raises the stomach's pH level. A higher pH means the stomach is less acidic, and this helps stabilize blood clots that are forming at the site of the ulcer. Stabilizing these clots is essential because, if they dissolve too quickly, the bleeding can start again. After a person has experienced bleeding from a peptic ulcer, doctors often give NA through an intravenous line at high doses for about 72 hours. This is especially common if endoscopic treatment has been used to stop the bleeding. The reason is that continuous acid suppression during this critical period helps keep the clot intact and supports the healing process. While some studies suggest that taking NA intermittently might be effective, the standard approach after a high-risk bleed is to give them continuously through Roman 4 for the first few days. For ulcers that are less severe, such as those with flat pigmented spots or clean bases, oral NA are often enough because the risk of rebleeding is much lower. Besides stopping bleeding, NA also help the ulcer heal by reducing ongoing acid irritation. This allows the damaged tissue to repair more quickly and reduces the chance of complications. Although NA are generally safe, especially when used for a short period, long-term use can sometimes have side effects. However, in the context of managing ulcer bleeding, their benefits in preventing rebleeding and promoting healing are well established and outweigh potential risks. In summary, NA help after ulcer bleeding by blocking the enzyme responsible for acid production, raising the stomach's pH, stabilizing blood clots, reducing the chance of rebleeding, and supporting tissue healing. They are a vital part of treatment alongside other interventions like endoscopy and supportive care, helping to improve outcomes for patients with bleeding ulcers. Always remember to consult healthcare professionals for personalized advice and treatment options.